Good day, everyone. So today I will be presenting a case report titled Hydronephrosis by an Aberrant Renal Artery. So this report was authored by Dr. Sanwa Lee, Dr. Hunyil Choi, Dr. Kyushik Kim, and Dr. Kwan Jin Kim. Today I will be your presenter. My name is Vicky Samaba, along with my other two group mates, which is Juliana Luis Badok and Becca Allen. So for the table of contents, we will have the introduction, the case profile, diagnosis, treatment plan, post-treatment and outcome, conclusion, and our reference. So to start, let's define what hydronephrosis is. So hydronephrosis is a condition where one or both kidneys swell due to a buildup of urine. This often happens when there's an obstruction in the urinary tract preventing urine from draining properly from the kidney to the bladder. So if this is left untreated, it can lead to a kidney damage and impaired kidney function. So, as the title speaks for itself, the hydronephrosis is caused by an aberrant renal artery. So, an aberrant renal artery is an unusual variant of the renal artery that can compress or obstruct parts of the urinary tract. So, in this case, the aberrant renal artery was found to be crossing and compressing the ureteropelvic junction, causing hydronephrosis. These vascular anomalies can complicate the diagnosis and treatment of urinary tract obstruction, requiring careful imaging and surgical planning. Now, let's move on to the case profiles. So, the patient is a 36-year-old woman who was admitted to the hospital with intermittent right flank pain that had persisted for 4 years. So the pain-free interval had become shorter, prompting her to seek medical attention. So the pain was described as dull, located in the right upper quadrant both anteriorly and posteriorly, and often occurred later in the day, especially after consuming large quantities of fluid. So she had been treated at a local clinic in the past for urinary tract infection, experiencing right flank pain and weakness during those times. So before we tackle these figures in the diagnosis, so during the physical examination, the patient had a blood pressure of 110/80 millimeters of mercury and exhibited costovertebral angle tenderness. So the laboratory test showed that her urinalysis results were within normal limits, with white blood cells at 0.1 per high power field and red blood cells at 0.1 per high power field. So biochemical analysis revealed a blood urean nitrogen level of 11.0 milligrams per deciliter and a serum creatinine level of 0.8 milligrams per deciliter. So as for the figure 1, this image shows an excretory urogram taken 30 minutes after the injection of contrast dye. So it reveals a severely dilated right pelvocalycal system, which is the part of the kidney where urine collects before moving to the ureter. So there is also noticeable thinning of the kidney's cortex, indicating long-term pressure. The ureteropelvic junction, where the kidney connects to the ureter, is clearly obstructed, preventing urine from flowing normally. So for the figure 2, this CT angiogram image using maximum intensity projection technique shows two renal arteries coming from the aorta. So the key point is the aberrant artery, which is this. It was indicated by an arrow that crosses over the ureteropelvic junction. So this crossing artery is compressing the junction and causing the obstruction that leads to hydronephrosis. So for the figure 3, so this source image from a magnetic resonance angiogram or the MR angiogram highlights the aberrant renal artery. Here it was indicated by an arrow. And It's external compression at the right ureteropelvic junction. So the dilated pelvocalial calyxial system. This is the dilated pelvocalycial system. So it is also visible, appearing with low signal intensity due to the severe obstruction. It was indicated by a triangle. So for the last figure, so this retrograde um, pielogram image shows an indentation at the right ureteropelvic junction caused by an external force. As you can see here, so this compression had resulted in severe hydronephrosis as evidenced by the significant swelling and expansion of the kidney's urine collection system. So for the treatment plan, to address the obstruction, the treatment plan involved a surgical intervention. Pyeloplasty was performed to relieve the obstruction. So during the surgery, the aberrant renal artery was identified and carefully preserved while reconstructing the ureteropelvic junction. For the post-treatment and outcome, the patient recovered well post-surgery with no recurrence of symptoms. So this case underscores the importance of considering vascular anomalies in patients with unexplained hydronephrosis. Proper identification and preservation of aberrant vessels are crucial during surgical intervention. So the pictures provided here are not the actual surgery that was occurred, but rather is sample. So to end this, in summary, this case of hydronephrosis due to an aberrant renal artery highlights the necessity of detailed diagnostic imaging and careful surgical planning in managing similar conditions. So awareness of such anomalies can significantly improve patient outcomes and guide treatment strategies in urology. So this is our reference. And that's all. Thank you.